agree that Housing Week should be about building houses and that this year's programme would be a waste of time to attend. I challenge that by replying that unless we understand housing needs, including future needs and environmental factors that will affect design, then councils, housing associations and developers will be building homes not fit for need. The reply, a non-acceptance. There seems to be little understanding across government and from some local politicians and developers of the joined-up thinking needed to address housing needs. I often hear that higher coded homes are not required nor lifetime homes. Instead, that homes can be retrofitted. However, those who understand housing needs understand the prohibitive cost to retrofit rather than the few extra thousand at build, and this has been well documented in the work undertaken by the Joseph Rowntree Housing Trust. If the city's homes cannot cope with increasing temperature rises, yet be insulated for colder spells, there will be consequences on the health of residents and the cost of the council, the clinical commissioning group and the NHS. The city also needs homes that people can physically live in. Whilst York's private stock of housing is of a better standard than many towns and cities, many homes have Category 1 hazards or fail to meet even basic Disability Discrimination Act requirements. Physical conditions are important to future design, as there is a clear message from older residents and those with disabilities that they want to stay in their own homes as long as possible. And evidence shows this has better health outcomes. So, we need to ensure that build is suitable for need. Most here today understand the links between housing and health and well-being. However, with unprecedented budget pressures on local government, this council has lost over 40% of its operational budget, and on health, which will have a national predicted shortfall of over 30 billion by 2020, services, provision and design need to change, with spend diverted from crisis intervention and treatment to prevention. Understanding these factors, the Council, working with its partners through the Health and Wellbeing Strategy, has started to make a move in the right direction. Firstly, to reduce health inequalities. I strongly believe that if we are to conquer the ills of inequality, we must tackle our physical environment. It is universally recognised that health and wellbeing inequalities are linked to poor and unsuitable accommodation and or lack of choices, especially in highly competitive housing markets when combined with low average household income. Poor housing conditions can give rise to a wide range of illnesses, and as with elsewhere, York's worst housing conditions are in its private sector. This council will, though, continue to monitor the city's housing stock and tackle poor housing standards through enforcement. As part of this, we see the importance of licensing of larger houses in multiple occupation and the benefits of the Article 4 planning direction. And the council is working with student unions and the Higher York Partnership to promote good housing management standards. We also want landlords to play their part, and so the council is extending the York Property Landlord Accreditation Scheme and working to develop closer partnerships with lettered agencies and local landlords. And we are currently holding a consultation with the private sector, and if people have not already contributed to it, we would be pleased if they could. Also to consider are fuel and housing related poverty and financial exclusion. All are increasing, and there are clear associations with health problems. The council can address fuel poverty and financial exclusion through collective energy switching, promotion of the Green Deal, and for our own housing, continue the ongoing Council House Improvement Programme. Further help is available for the provision of dedicated employment and money advisors, and we are helping tenants access affordable credits, as we have heard from Steve, through the Rental Exchange Initiative. Financial problems, though, can lead to homelessness, and those experience it can be vulnerable to poor health and well-being. By working in partnership, we need to continue to dispel the myths behind homelessness and explain its costs. Homeless Link estimate that each homeless person costs the public purse £26,000 per year. Recent figures show that hospital usage by homeless people costs around £85 million per year. They attend A&E up to 6 times as often as the general population, are admitted 4 times as often, tend to stay 3 times as long, and more than 70% are discharged back onto the streets, resulting in readmission. I am pleased to say that in York, Artlight has undertaken some work to tackle this last point. Working with partners, it is our duty to ensure that residents don't become homeless through support and guidance. If there is a threat of homelessness or actual homelessness, Then working together, we can help with access to suitable accommodation, including through your property and your home social letting agency, to enable wider access to the private rented sector. Adult resettlement and support schemes also play a crucial role in helping people into self-sustained independent living. And we must not forget that the city is also made up of many diverse communities who also have diverse housing needs. There needs to be a recognition by some that one of our oldest ethnic groups displays some of the city's work health outcomes, that is our Gypsy, Roma and traveller community. Reducing their health inequalities is vital if their life outcomes are to be improved. It is not only a legal requirement, but I believe our moral duty to ensure suitable accommodation now and for the future, and the health and wellbeing support for the Gypsy, Roma and traveller community through working with them, York Travellers Trust and other partners. The health and wellbeing strategy for York is also about having a great city for older people. However, much of the city and country's housing stock was not designed with the needs of an ageing population in mind. Many older residents live in homes that are hard to maintain or present hazards to health and wellbeing. Recent data suggests that 6,500 of the private stock, around 9% of York's dwellings, exhibit a Category 1 hazard. Common hazards are excess cold, risks of falls and stairs, and electrical issues. This needs to be considered alongside Housing in Later Life reports by Age UK, which noted that just 3% of homes have recommended accessibility standards, and they are calling on government to ensure homes in the future are built with them. Correct design and build is important when considering adaptation costs. Working in partnership, the city can widen housing choices for older residents through better provision, information and advice to help make timely and informed decisions. The Council is keenly aware of its role in the process. To help, the government has funded an older people's housing options advice worker who can help with options on accommodation, adaptations and practical help to support independence. Through planning and the emerging local plan, this council is ensuring all new homes will be designed to help support independence in later life. And as part of the council's house building programme, we are providing downsizing opportunities. As an example of good practice, I would point to the council's Betfield Lane development. The houses have been constructed to our list to be installed, bathrooms can be adapted to wet rooms, and a number of the one-bed flats can be altered to provide overnight room for carers when required. Mental health and housing needs also to be addressed, yet the links with suitable accommodation are often ignored. Evidence shows the impact on mental health from poor quality housing can be as damaging as those to physical health. Perhaps we should reflect on the fact that up to 70% of people using homelessness services suffer from mental ill health. Help is also available for supported housing for those with multiple needs or high-risk behaviour. Together, we need to meet the needs of homeless people entrenched within inappropriate provision or in hospital wards through the specialist supported housing as a pathway to independent living. This can be achieved through developing a mental health charter for York to ensure a consistent approach. And we should not forget the next generation. York is, and we want it to continue to be, a great city for children and young people. Poor or inappropriate housing can significantly undermine the child or young person's health and well-being and affect their long-term life chances. There are also an increasing number of households containing children with complex needs. Providing appropriate adaptations to homes is cost-effective, considering out-of-city placements can cost the council between £150,000 and £300,000 per year per child. We are working to ensure a supply of good quality affordable homes for families to meet the needs of overcrowding and inappropriated accommodated families through our new build council housing programme, and the programme of block conversions is underway. And homelessness is also experienced of the young. Being asked to leave home, the family home, is one of the top reasons for youth homelessness in the city. These young people are some of our most vulnerable citizens, so it is important for their future well-being that we provide dedicated housing provision and support services that provides a clear resettlement route to independent living. We understand the importance of early intervention and are so developing closer links with schools to engage with young people at risk to prevent them facing a housing crisis. To conclude, as many of you have heard me say before, and I will say again, I will not rest until every York resident, in fact everyone in the UK, has a safe, warm and affordable home. I truly believe this is a fundamental human right, and I will keep fighting for this, whether I'm in this building or elsewhere. And my experiences were set from Manchester in the 1980s, seeing the deprivation that was there, and this cannot be allowed to continue in this country. With safe, warm and affordable homes, we can achieve better outcomes for all our generations. Thank you.